Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to your Direct Connection. Coming up tonight, the story of a milestone coronavirus patient, the 1,000th person successfully treated and discharged by a University of Maryland Medical System hospital. That's coming up. First tonight, we meet a member of the medical team that cared for that individual and so many others. Dr. Peter Olivieri is a pulmonary and critical care physician at the University of Maryland, Baltimore, Washington Medical Center. Doctor, thank you for being with us. Give me an estimate. How many people have you seen with this condition? And tell us what's been learned over the past couple of months about treating people.
Good evening. Thanks for having me. Well, we've had over 400 patients that have come through our particular hospital with this disease, and about 60% or more of those have come through the intensive care unit. So that would be the estimate. In terms of what we've learned a tremendous amount. Obviously, there's still lots to learn, but we've definitely learned that when facing a disease that nobody's ever seen or treated before, we can pull together as a team and provide care for our patients, and that we can get them through things that initially may seem almost insurmountable.
What are some of the challenges of treating somebody with, especially in a severe case of COVID-19?
Well, in some ways, this disease is similar to other acute medical conditions, particularly respiratory failure or breathing problems that we treat in the hospital, which is often caused by other infections. But there are definitely some unique challenges as well, which one of those is just the fact that it tended to be so severe in comparison to some of the other patients, or other conditions that cause respiratory failure. So we had to really kind of max out the life support capabilities that we had in some cases. And obviously, there are lots of other challenges as well, including the unique isolation requirements for these patients and personal protective equipment that healthcare workers have to utilize in order to try to prevent spreading the condition to other patients or to themselves. And obviously, just the element of the unknown, that this was something that we hadn't seen before. We weren't sure which medications and treatments were going to be most effective. And in some cases, during the peak of some of the surges, there have been obviously significant shortages of critical medical equipment, which created unique challenges.
Just amazing how far we've come. I mean, as we're talking in the middle of July, the number of people in intensive care units across the state, a little bit over 100, which is roughly 1/6 of what it was at the peak. So obviously, the trend there has been terrific. I'll ask you how it's been at your hospital, but should also point out that it's kind of a trailing indicator of what's going on, because it takes a period of time for somebody to unfortunately catch it, develop symptoms, and then get worse before they wind up in your care.
That is absolutely true. Yeah. And we are happy to say that we have seen a significant reduction in the number of cases statewide as well as in our own medical center. And we've certainly seen significant reductions in the number of cases here. So just to give you an idea, over the past week or two, we've been averaging around 10 patients in the hospital overall in the entire facility that are confirmed to be positive for COVID-19. And this is in comparison to heavier times when we may have had 60 or more patients or 70 in the hospital with this condition.
Let me get your basic advice for somebody. Well, before I do that, let me remind our viewers that if you have a question about this disease, how to treat it, give us a call. The number will be on the screen. You can also email your questions to livequestions@mpt.org. So, doctor, what I was going to ask is what should people who may suspect they have it, they may have a cough, they may have a fever, some of the other telltale indicators of this, what should they know about initial stages of care and when to worry?
Great question. Well, any symptoms, as you mentioned, fever, cough, muscle aches, and that type of constellation of symptoms should definitely prompt a patient to self-isolate to the maximal extent that they can and really pay close attention to the development of any new symptoms. And in particular, shortness of breath is something that should really prompt them to seek medical attention in a hospital setting. If their breathing is fine and they're not having any trouble there and it's just a little bit of cough and fever and they don't feel like things are getting worse, they may be perfectly safe to stay at home and self-isolate. But this doesn't preclude reaching out to their primary physician, as many practitioners are now able to provide telehealth visits remotely to at least take a look at the patient and make sure that there isn't something else going on. We definitely don't want people out there ignoring symptoms.
Well, it's a similar question from a viewer. Stacy wants to know, what do you do if you test positive while you were quarantining at home? And you know, not everybody has a primary care physician. What do you do in that case?
Again, if you're just having a little bit of, for instance, cough and some fever, and you're feeling otherwise okay, and particularly paying attention to how well you're breathing as you walk around your home or elsewhere, if you're not having any shortness of breath, you may be able to just stay put. But if there's any shortness of breath at all, I would recommend seeking care in a hospital setting. And certainly in the interim, to the extent possible, to touch base with your physician.
You know, in normal times, you take care of people who have various lung conditions, a lot of chronic illness. I'm wondering if there's the same phenomenon we've heard about with other conditions, where people are basically afraid to go to the doctor. They're afraid to go to any medical setting, thinking that it's full of people with this virus and they're going to get it.
Unfortunately, that is a phenomenon that we have seen, particularly as of late. And what we want patients to know is that if you're having any concerning symptoms and you're worried about your health, you should absolutely come to the hospital if you're concerned. The hospital, while it's true that we do have patients here that are infected with COVID-19, we're very careful about proper isolation practices. We have these patients in isolated rooms where patients that are coming in through the ER are not going to be exposed to those patients. And we certainly don't want people ignoring symptoms that could be very worrisome, as they may miss their opportunity to head off a very serious condition. And we have seen recently several patients, just for some examples, that have presented late with heart attacks, myocardial infarction or acute coronary syndrome, where they have blockages in the critical arteries in their heart. And these are people that were trying to ignore some chest pain for several days and coming into the hospital much later than they otherwise would have if we hadn't been in the midst of a pandemic. And unfortunately, when people come in late, that does lead to, in some cases, a worse outcome. And similarly, we've seen those types of trends with lung cancer, where patients may have cough and shortness of breath and other symptoms that they were concerned about, but again, as you mentioned, they were afraid to come to the hospital because they didn't want to be exposed to COVID-19 patients, and then they end up presenting with later stage lung cancer that could have been intervened upon earlier and perhaps could have led to a better outcome. So we definitely do not want patients to ignore their symptoms.
Yes, sir. Let's take a phone call. Jackie in Howard County. Jackie, thanks for the call. Go ahead.
Hi. Thank you, doctor, for all the work, everything you do. God bless you all. What is the soonest you think we're going to have a vaccine?
Thanks very much. Doctor, your thoughts?
It's a great question, and I have to be very honest with you that I'm not a vaccine expert, so I'm not the best person to give you a really intelligent answer. Having said that, there are several challenges with this. With viruses, our ability to develop an effective vaccine really comes down to very specific details about the nature of the virus, and in particular, the types of proteins that are studding the surface of the virus that the body's immune system can recognize. And in some cases, the body's immune system is able to form an effective immune response. And in other cases, it's really a challenge. So to give an example, with influenza, you see that year to year, the vaccine varies in its effectiveness, and vaccine specialists have to continually modify on an annual basis the vaccine to try to keep up with the mutations and changes that the virus makes to try to outsmart us. And so I think it remains to be seen where we're going to land with this particular virus. I think that there is some promise. I know that there are multiple vaccine candidates that are under development and underway, even locally here in the Baltimore area. And so I think we'll get some information preliminarily over the next several months to year about that in terms of what the options will be. Some of the other challenges, though, with vaccines is that because these are interventions that we're going to be recommending for so many people, the bar is set very high to make sure that they're very safe. And so generally, part of the reason vaccine development takes so long is that you have to test so many patients to make sure that the vaccine is safe and free of any major side effects before it's fit for use in the masses.
Let's take a call from Anne Arundel County. This is Dean. Dean, thank you for calling. Go ahead.
Yes, thank you. I was tested initially on June 22nd. On June 24th, they called me and they said, you tested positive. I went into a 10-day quarantine, which ended July 3rd. I got tested again, and I'm waiting for results. I really don't know what the difference is between a PCR test and an antibody test, and which one of these tests should I be actually taking?
Dean, best of luck to you. Thank you very much. And doctor, in terms of even the tests in the hospital, have you seen the false positives, false negatives?
All great questions. So first, to deal with the caller's question, the PCR is a test that looks for the viral material that's actually actively shedding from the body, and it's usually a swab that goes into the nose. And what this is an indicator of is active viral activity within the body, as well as your ability to transmit the virus to other people that you may come in contact with. So that repeating that test is very important to determine whether you are still potentially at risk of infecting others. So that's probably the one that you want to get repeated to make sure that it's safe for you to come out of quarantine and come into contact with other people. The antibody test may provide some information about whether or not your body's immune system has created protective antibodies that may confer some, hopefully, protection to you in terms of your ability to contract the virus again. And I think our knowledge of that is still evolving. It's a bit complicated. There are several different antibodies that are being tested for, and these are not necessarily the same antibodies that confer protection. So I think it remains to be seen what we should do with the information in terms of the antibody levels. Presumably,
Doctor, I'm going to jump in just because I'm down to a few seconds. I have time for like 2 sentences from you on this. What do you want people to do so they don't catch this thing?
So just follow the guidelines that are out there. Wear a mask in public places as is recommended. Do a really good job of washing your hands. Avoid large crowds of people when it's not necessary, and try to limit your contact with others to the extent that you can.
We're going to leave it there.
Just follow the common sense.
Very good. Dr. Peter Olivieri, sir, we appreciate the time. Thank you very much. And Direct Connection continues in just a moment.
Our job is the truth.
I'm a journalist.
My destiny is to rule this country.
I will not run away.
Yes, Mom.
It's very exciting.
Lord, I'm getting tired of being so lonely. I've got the fire inside that burns more than it lies.
Sir, are you a gentleman?
How dare he?
I'm a strong woman and I've got my own. I'm in control. I need somebody to
I refuse to be tamed. Kiss me. It's terribly hot, isn't it?
No.
Please be mine again.
No.
And joining us now is the 1,000th patient to be discharged from a University of Maryland Medical System hospital. Joining us from Elkridge is Steve Nicewarner, along with his daughter, Jonna, who happens to be a nurse at the same hospital, the Baltimore Washington Medical Center. Nice to see you both. Thanks for talking with us. Steve, if I can ask you to take us back to May, how did this get started for you?
I guess about, was it May 18th, 17th?
Around there, yeah.
So around there, I was feeling tired and basically wanting to lay around all day on my week off from work. And then I decided, at the request of my daughter, I took my temperature, and it was 104.8 or something like that. And I said, well, let me take some medicine, go to bed, and see what it is in the morning. Took it again in the morning, and it was like 104.2. So she requested that I contact my primary physician, who then told me to go get tested through a local, it was a MedStar location down on Key Highway. So I went down there, got tested. About 3 hours later, I got a call back and said, you're positive. So I said, okay. She said, just self-quarantine and so on. So then that week, sort of laid around some more. And then my daughter, at the end of that week, decided that she knew better of my health condition and I should go to the ER where she works. So I did.
Jonna, let me ask you about that intersection of being both Steve's daughter and also a nurse. You know, which hat were you wearing when you started giving that advice?
So it was a little difficult. I don't know, I felt like I had some insight to it because I had actually tested positive first. And I was also feeling, not so great. So I was definitely wanting him to rest and stay hydrated and keep monitoring his vital signs, his temperature, his oxygen level, all that good stuff. And then when I felt like we were doing a pretty good job with keeping him hydrated and keeping him out of the hospital. But then the day that we kind of took the turn and made the decision to go into the hospital, his oxygen levels were too low for us to just keep him at home. So it was a little hard because I knew that him going into the hospital held a lot of anxiety for him. And obviously, we don't want our parents to be anxious about that, but it was a critical situation, and being a nurse in the ER and working with these COVID patients, we see how fast those patients can deteriorate, and it was really scary, I think, for all of us here in the house, just because we always figured that if Dad were to get it, he was going to get it the worst of anyone, just because of, unfortunately, his comorbidities. But yeah, it was hard because I driving him to the hospital and sitting there with him, because I knew he didn't want to be there. But at first I thought, okay, it's not as bad as we thought it was. While we were sitting in the ER, it seemed like he just needed a little bit of oxygen at first, but then things got really scary once they started going downhill and he started deteriorating quickly, like we had seen in the emergency room so many times before.
Steve, I want to ask you about your time in the hospital, but before that, what advice would you have for anybody watching who maybe, unfortunately, so many people have been getting this and they're in that situation where they have a fever, maybe the cough, maybe some other symptoms, and they're really not sure what to do. What did the two of you learn through this process?
It's good to have a nurse in the house, but not everybody has that. But I think if you start getting the symptoms, then you reach out to your primary, or like so many places now, they have you don't even need to have an appointment to walk in and get tested. And then just watch your vital signs after you get tested. And if they start going in the wrong direction, get to the ER as quickly as possible, so you can get hopefully some quick information, and they can start taking care of you quickly. Like Jonna said, my my fear was, and I expressed this when she said to go to the hospital. I told her I'm not going to the hospital because my fear is I'm not coming out of the hospital. So fortunately, I was able to come out of the hospital. Unfortunately, many others do not. But that was my fear, was that I was going to go in, and the last time I saw anybody was going to be sitting here on the front yard as I got into her Jeep and went to the hospital.
Steve, that was you were in for a month, right?
Yeah.
And
I don't remember most of it.
Don't remember because they gave you stuff, you were sedated, or other factors?
It was sedation. And actually, John and my family knew what was going on, so they could tell you what I was actually going through in that month. My sedation caused a lot of really, really crazy dreams. And at some point, I may sit down and write a book about it, but I've got crazy dreams all over the place.
Yeah.
Which is even weirder.
Heard that from other people as well. And Jana, you go to work in this hospital, but you work in the ER and you weren't able to go upstairs, I guess, where your dad was.
That is correct. I was actually still out on my quarantine. I had like another week left on my quarantine by the time he went into the hospital. So I wasn't able, to go in there anyway. But then when I finally was able to go back to work, people ask me like, how are you here? How are you working? Like, how are you, handling this? And it's like, well, I would just be sitting at home, but like worrying instead of being here helping other people. But it was really difficult because the ER is on the lower level of the hospital, and then the ICU where he was at is on the second floor. So I was 2 floors below, and my dad was up there and, in critical condition. And it was really hard not to just go up there and, go check on him, even though he wasn't awake. It was really hard not to be there for him because we all knew how scared he was going into this. And then even when it came time to have to intubate him, we all knew how scary it was going to be. So that was really hard not being able to go up and see him.
Jana, what are you seeing in the emergency department these days?
So I feel like we had a little bit of a lull with those patients. We call them PUIs, persons under investigation for the coronavirus. I feel like we had a little bit of a lull with seeing those patients. It got back to the regular medical patients, but then I worked last night and it was like day and night. I came in and there were so many people who had one or multiple symptoms of the coronavirus, whether they had it or not. We have to treat them all like they have it. But it was a pretty fast change. I don't know if that was because of the holiday weekend or just the warm weather, everyone getting outside, wanting to do outdoor activities. But yeah, at least from last night, we've been seeing an increase.
For somebody, Steve, who didn't exactly look forward to being in the hospital for anything and then having to go in for this, I'm just wondering about the personal stuff. Like normally, everybody you meet, there's some of the nicest people in the world, and there's eye contact. Somebody will shake hands with you. That can't really happen as much in the ward you were in, right? Everybody's got masks and gowns, and it's got to be even scarier from that standpoint than you might have expected.
Yeah, actually, everyone was in gowns and face masks and masks over their mouth and gloves, and there were even some people that walk around with a different kind of outfit with all that look like they're from Star Wars. The mask setup they have and a tube that goes down their back, I don't even know what it is, but it looks like they're straight out of Star Wars.
It's called a PAPR. So it's like a hood that goes over top of your head, and it's giving you, I guess, this oxygen, this air. And it's hooked up. It has a tube down the back, and then the battery wraps around your waist. So it's just if they're like were to intubate you, they would have been using that. Any aerosolizing procedures, like neb treatments or anything like that, they have to wear it just because all the particles from COVID float around. Yeah.
All right, so last question, and Steve, I'm really glad you're feeling well enough that I can bring up this part of a month stay in the hospital, which may be the scariest thing. Have you seen the bill from this yet? And I know you work for the feds, so you probably have good insurance.
Yeah, the insurance is good. I've seen a lot of individual doctor bills, which fortunately the insurance so far has been covering. I have not seen the hospital stay bill yet.
All right.
I think they're still, like, they may have run out of addition tape and they're trying to get a new roll or something, but I'm pretty sure it's going to be a large number.
Well, if you do have to write a check, hand it to Jana and have her deliver it personally. That would be nice. Jana, in just 10 seconds, any of your friends, people your age or your dad's age watching, what do you want them to know?
Exactly what Dad's saying. Just do good hand hygiene, social distance. Right now it might seem like a good idea to go out and hang out with all your friends and whatnot, but it's not worth it in the end. You don't know who you're going to be getting sick, yourself, your family, random people. It's just not worth it.
Jana and Steve Nicewarner, continued good health, sir. Thank you for the time.
Thank you.
Thank you.
And that's Direct Connection for this week. Remember to follow us on Twitter @MPT News. Now, for all of us here at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.